Again, good afternoon. Welcome and thank you for joining us for the 7th Enhancing Tribal Environmental Health Programs Engagement Webinar in the COVID-19 Response Webinar Series. My name is Audriana Marzette, and I am a Public Health Program Manager with the National Indian Health Board. And I will be today's moderator. And we are joined by Ms. Desiree Mack, and she will be providing details on what the Alaska Native Tribal Health Consortium includes in their COVID-19 care kit and discuss their outreach activities to mitigate COVID-19 in Alaska. So today we have a good presentation because she got some solid background and I have seen the kits and it's nice, y'all. So before I turn it over to Desiree, let me just go over a couple of housekeeping notes. As you see, today's session is being recorded. If you do not consent to be recorded, you are asked to drop off the call at this time. Okay. All participants have been muted. Please leave yourself on mute unless Desiree specifically asks you to unmute and engage. However, anytime you're having trouble hearing during the presentation, please let me know so I can try to provide you that TA. Also, the recorded version of this webinar will be posted to NIHB's YouTube channel. I will email all registrants the PowerPoint slides from today, along with the YouTube link and the webinar evaluation. I encourage you to enter your questions into the chat box throughout the webinar. Once we get to the Q&A portion, you may either continue to type your questions or you may unmute and just ask the questions. But we do ask that you turn on the camera and just have that one-on-one with Desiree. She won't bite, I promise. She'll hug you, but she won't bite you. If you have a problem that you do not know how to solve, again, that goes with your sound go out, maybe it's freezing, please let me know and I will see how I can assist you. So before I move and allow Desiree to have a floor, I do want to just introduce her real quickly. She's the Senior Program Manager for the Alaska Native Tribal Health Consortium and manages the Tribal Capacity and Training Program. For the past 14 years, she has worked closely with over 200 tribes to build local environmental program management capacity. Her and her team provide training, outreach, and technical support to Alaska tribes in grant development and management, community planning, environmental health outreach, project development, and climate change adaptation. I had the honor with working with Desiree last year on a cooperative agreement with USET, and she is full of energy. She has a very positive aura about her, and she's very smart and very professional. So I know this presentation is going to be awesome and very beneficial to you and to your partners. So without further ado, I now turn it over to Desiree. Thank you.
All right, thank you so much, Dre, and welcome everybody. Thanks for joining. I'm Desiree Mack. As Dre had mentioned, I work with the Alaska Native Tribal Health Consortium, where I've worked for the last 14 years. I am originally from King Cove, Alaska, down in the Aleutian chain area, and I'm an enrolled member of the Agdagu tribe in King Cove. So today, I'm going to share with everybody a little bit about our care kits that we had developed under a project that we participated in with NIHB with funding through the CDC. And if you have questions throughout, feel free to drop them into the chat box and we'll have time at the end also. You could also raise your hand using the little emoji button and I'm happy to take questions as well. So this project got started in early 2021, and I'm just going to share a little bit about my organization to kick us off. The Alaska Native Tribal Health Consortium is a statewide tribal health organization in Alaska. And it is our vision that the Alaska Native people are the healthiest people in the world. So ANTHC is the largest, most comprehensive tribal health organization in the United States. It is owned and managed by the Alaska Native people. There are, across the state, 11 distinct cultures and over 200 language dialects. We partner with our regional tribal health organizations and tribes from across the state of Alaska and serve over 189,000 Alaska Native American Indian people from over 200 communities. So we're a very vast state, and a lot of the communities that we work with, the vast majority are not accessible by the road system. So we really have to look at logistics in step as we're working to provide the best health services across the state. So ANTHC has three primary areas. First, we have our Alaska Native Medical Center, which is a hospital that is a statewide hospital, and it offers comprehensive medical services and acute, specialty, primary behavioral health care to Alaska Native American Indian people. And it's a very unique hospital, and we really focus on meeting the special cultural needs of the people that we serve. The next area is the area that I currently work in, is the Environmental Health and Engineering division. And within our division, our programs really focus on water and sanitation and utility infrastructure needs. We help build, connect communities to water that may not be on water systems. We provide technical assistance, training, and support for projects that improve environmental health of the communities that we serve. And these include climate change impacts. And then we also have our Community Health Services division, which really focuses on promotion and prevention services, wellness, research, education, and disease prevention. So together, the three areas of our organization during the COVID-19 pandemic really had to come together in order to best serve our people. And it really took staff from our hospital side, our community health services, and us in the environmental health and engineering to come together to make sure that we're providing the best education and up-to-date information to communities from across the state, with a lot of our partners from local communities and our regional hospital locations throughout the state. So some of the things that we focused on being a hospital as well is vaccines. So we really worked to look at vaccine logistics, how we were going to get vaccines distributed across such a vast area, setting up vaccine clinics and providing education to people on the importance of getting the vaccine and the safety information associated with that. We also launched a mask campaign called Wearing is Caring. So throughout our campus and throughout Alaska, we really looked at distribution of masks. For a time there, masks were in really short supply. And so we worked together to make sure that our healthcare workers, along with all of our customers, had access to masking during this time. Another area that we focused on was hand sanitizer distribution. So this was one of the working groups that I got to sit on, and I learned way more about hand sanitizer than I ever thought that I would in my entire life. But our organization had gotten a bulk donation of hand sanitizer, which was great. We needed to get that out across the state, but there are so many things that we needed to think about. The sanitizer came in these big 5-gallon buckets, and we had to figure out how to get them into smaller containers. There were insurance things that we had to deal with, safety and storage, and plans for discarding anything that wasn't used and where it was going to go, and whether or not the places that it was going to be going had adequate storage for it. We also worked a lot on outreach and education. So I think everybody from all 3 divisions kind of came together and developed flyers and campaigns for a lot of different areas. And we'll talk a little bit more specifically about some of those here as we move forward. Statewide tracking. So we are very involved in looking at the data of what was happening in our state. This included daily and weekly meetings with state and tribal partners, and looking at the number of patients we had in care. And a lot of different data was being examined throughout this whole time. And then treatment. So like I mentioned, we have the statewide hospital, and we have hospitals in all of our regional areas of Alaska as well, and then clinics in all of our local communities. So treatment for those that came down with COVID-19 was something that we really had to focus on as well. And then documenting best practices. So through all of this time, we were really detailing what it was that we were doing, and providing documents that outlined best practices. We conducted interviews through this project with some of our tribal partners to learn more about innovative approaches that they had in responding to the COVID-19 pandemic. And the important thing about that is that as time goes on, we will learn from each other so that we could be more prepared in the future. I just want to touch on this bottom photo here. on the right-hand side of the screen, I guess, where all the people are standing by a little white trailer. And that trailer down there was an innovative approach that came out of all of this. It's a hot box for mask sanitizing. So with our organization, with the hospital, we have a lot of healthcare workers, and with the mask shortages, there weren't enough masks to be able to keep up with the demand. And so our engineering crews came together and did a lot of research and testing and built their own custom hot box. So healthcare workers would rotate out their masks and they would go into this hot box and get sanitized, and then they would be distributed back to the different medical providers as they were getting done with the sanitation process. So those are just some of the areas that we focused on. And let's see, through this project, I know you guys came to learn a little bit more about our care kits. So through the NIHB project, we were able to assemble educational care kits for communities across Alaska. And the kits included a bag with some educational materials. We took the opportunity, since we're mailing these out, to include some other educational materials. Down on the left-hand side, there's a picture of Molly of Denali, which is a PBS special show, and our emergency preparedness program worked to develop that children's book to help communities be more prepared in the event of an emergency. Also a youth environmental health explorers booklet that educates people about environmental health of their communities. So our kits included everything from masks to hand sanitizers, educational stickers. The kits came out, towards the end of when people were starting to go back into the workplace. And so our marketing program put together posters for people returning back to the workplace. Also some educational materials on COVID-19. And we had little packets of soap. A lot of our communities don't have access to running water. And so the little soaps were just, I think, individual little sheets of soap that you'd put in your hands and wash them. So it wasn't a bar or anything like that. We had little medical kits that had just general supplies, kind of a mini first aid kit, some cool packs, some sanitizing alcohol wipes, and these face masks. Let's see if you guys could see this. Doesn't do so well with the background, but these were our Wearing is Caring campaign masks, and those were included in our kits along with N95 masks. Also were included in the kits for both youth and adults. Some of our educational materials included these door signs that would kind of prompt people to put their mask on before coming into the door. And then one of the things that we did to get these distributed was put up a registration form for communities to sign up for these kits. And we distributed about 400 kits throughout Alaska by request. And we did have higher requests than we actually had supplies to send out. And I heard really great feedback from the communities that received them. And a lot of them were actually breaking them out. So instead of just handing out the kits, they were taking out some of the youth materials for activities that they were doing specifically for kids, taking out some of the workplace items and utilizing them in their office. And so they were, depending on the community, figuring out different ways that they wanted to break these kits up and distribute them in whatever was the best process for them. So a lot of educational materials. So we have a staff of over 3,500 people that work for ANTHC. And many of us participated in efforts on designing educational materials for our customers and our staff. Some of these materials included just general information, educational materials on vaccines and getting tested, ways that you could protect yourself and others, returning to the workplace, travel safety, safety materials, information for businesses as they were beginning to open up again, and also utility operation for landfills, water treatment plants, Head Starts, schools. And then with this project as well, we're able to share information on best practices for coming together again during large tribal gatherings, and also food facilities, sanitation, best practices as well. And I'm going to share a couple of those materials with you guys here shortly. And those will be files that I'll also upload into the chat box. A few resources and information can be found on our website. So to learn more about ANTHC, could visit our main website, anthc.org. A lot more information on our medical center, anmc.org. And then a lot of our COVID-19 resources that were put together for our customers, either by ANTHC or some of our partner tribal health organizations, could be found at that website there as well. And oops, wrong one. I'm gonna actually grab that link after and I'll put that into the chat box so you guys could check that out. So ultimately, all of the work that we came together to do really was for the people that we serve, for the communities that we serve, and to help us meet our vision that the Alaska Native people are the healthiest people in the world. And it really did take everybody coming together, whether it was creating educational materials, putting together the kits that we're sending out to communities, and masks and hand sanitizers, and everybody communicating together in order for us to get through successfully as we possibly could. And that is gonna be it for me. I'm gonna stop sharing, and if anybody has any questions, I'm happy to take questions at this time.
So thank you, Desiree. While people think on some questions, we did have a couple to come in when people registered. So the first question says, if possible, can you speak on if you have any COVID-ready kits for those sheltering unhoused, chronically unhoused people?
Okay, could you repeat that again, Dre?
Yes, ma'am. If possible, can you please include and discuss more information about being COVID ready and sheltering chronically unhoused people?
All right, so I know this came up a lot, and it was really something that we had to work through. We don't have kits and stuff ready and available to go at this particular point in time. And I think during the time, one of the big concerns that we had was in our rural communities, housing is just such a problem. There's not enough housing. So you've got sometimes multi-generations of people living in the same housing. And so, you know, it really depended on each community and how they determined the best ways to be able to quarantine and that kind of stuff. And I know communities really came together to take care of people, to make sure that they had the supplies that they needed and food and stuff like that. Some communities had special housing that was just for people who needed to quarantine. But it really was a challenge trying to figure out all of the logistics in houses where there's multiple people staying. So yeah, we don't necessarily have kits like that available, but I think that is a really good thing to think about as we think about future pandemics and things that we should think about preparing. I think this is one of them.
Mm-hmm. Mm-hmm. You have I'm gonna ask you this question in the chat box before I get to this next one from the registration. Miss Erin asked, did you hear any issues or concerns about the use of chemical products that may cause health issues? If so, how did you communicate?
All right, so we didn't hear about any issues per se about chemicals. We did provide a lot of information on how people should use chemicals, the bleaches and things like that for sanitizing and ventilation and airflow. So we did provide a lot of guidance on that. We also ran across storage. So a lot of these products were going out in bulk. And so that was something that we ended up having to think a lot about as well, is how communities were going to safely store these materials. And so, yeah, so when it came to chemical products, we really provided guidance on how they should be stored and how they should be used to be most effective, and how they should be used to not cause any type of health concerns. So well-ventilated areas, safety gear like gloves and masks and stuff like that.
And so the next question is, and you kind of like touched on it, but I guess they are wanting maybe a little bit more detail. So the question is, sorry if you have already answered this. I know you have went over the COVID-19 care kits and how to access them, but is this something that a program will prepare themselves with the same items, or do we select per family needs?
So I think it could be done in either way. For us, with this particular project, we had already done a lot of research on things that would be helpful in prevention, and if people were to come into contact. So so these were pre-assembled kits. I think that if you were really working directly with a community, I think it would be really beneficial to be able to have a checklist and distribution of supplies that are more specific to the needs of the family that's receiving them. So I think that there are multiple ways of doing it. It's just really dependent on the supplies and stuff that you have. So.
And so Mr. Buck Jones, Desiree, for this care kits, Desiree had participated on a cooperative agreement with the National Indian Health Board on a grant given to us by the Centers for Disease Control and Prevention. So they use CDC federal funds for these COVID kits.
Yes, for these COVID kits, they came in, they were made possible by this project, but there was a lot of other funding that helped support some of the other projects and stuff that I touched on, and a lot of different programs, departments, and divisions coming together to make everything happen. And that included state, federal, tribal, everybody.
So Desiree, I have a quick question for you. Put you on the spot a little bit. So as we know, and if you do not know, now I guess we're all about to know that there has been reports of new COVID variants, the BQ1 and the BQ1-1, and how currently they account for about 11% of new COVID cases in the US. In your opinion, as someone that does outreach and like to stay ahead of like outbreaks, what do you think would be the most important thing that health educators, health facilities, tribal organizations could be doing to prepare their communities for a possible outbreak like Omicron?
Yeah, so I think, things change very quickly. And one thing that we learned is that As health educators, we just really try to stay on top of the most current information and be able to provide that to our communities through whatever means possible. We were creating flyers and all sorts of educational materials and sending out to our various listservs, hosting special webinars to provide information to people throughout the state. And, any way that we could try to get the word out, I think using as many of those avenues as you possibly can is really important. And just helping people to be more prepared. I think, general behavioral change information, and I'll share some of the educational materials that we've developed here. Sometimes just getting that out and behavioral changes like washing your hands and sanitizing surfaces and things like that is some of the best prevention. But also, I think having things on hand, like testing kits and thermometers and things like that in case you do get sick. So I think those are all important. And I'm going to pull up a few of these documents here and share really quickly, if you don't mind, Dre.
Oh, no, ma'am, we're on your time.
Okay.
And while Desiree pull that up, if we have any more questions or anyone have any comments, please raise your hand or include those in the chat box.
Okay, and are you seeing, let's see, show. Okay, so you see the poster that I have here?
Yes, ma'am. Can you zoom in just a little bit?
Yes. All right, so I'm going to kind of scroll through some of these and I'll add the files into the chat box here shortly. But I think, one of the things that we learned in developing these educational materials was to use a lot of visuals when we could. And I'm not gonna focus on anything specifically here. I'm just gonna kind of scroll through, and when I attach them, you guys could look through them at your leisure. Let's see, returning to the workplace, a lot of visuals. So, this is cleaning and disinfecting and, showing visuals of where germs are typically found as we're in the workplace. General guidance on social distancing. Let's see. Tips from behavioral scientists. Let's see. Uh-oh. Okay. So these are, the kind of preventative posters and stuff that we're putting together within the organization. Here was the door signs. Let's see. And then COVID-19 information in your family. There's posters that were included in the kits on this topic. these were actually vinyl stickers that were printed, and those were sent out in the kits as well. These were also little stickers that we put together and sent out into our kits. And one of our Alaska Native graphic designers, made sure that the characters that are in a lot of our outreach material and stickers and things like that were representative of our customer base. So just more, we did a lot of contact tracing as well. So, this was not limited to hospital staff. We had people from our environmental programs and community health services all joining together to do a lot of contact tracing. This was one that was shared, that was developed by NIHB, and I think Dree is going to talk a little bit more about this campaign that they did. So that was a good one. And then the food facility sanitation practices, which was also done through this particular project. So I just wanted to, let's see, share those really quickly. And I will put some of those into the chat box, some of those files, so you guys could open them and see them on your own. Okay.
And so Desiree, while you put, I'm sorry, can you hear me now? So while you put some of your resources in the chat, let me go ahead and just talk about the Act of Love COVID kits. So happy Wednesday, people. Thank you all for being with us today. So I'm going to be real quick because we only have about 15 minutes and I want to make sure I'm utilizing you all's time wisely. So first and foremost, again, thank you, Desiree. I have enjoyed being your partner and we continue to meet, and we saw each other at the Environmental Health Conference in Minnesota. So awesome. But one thing that I do want to talk about is NIHB has the Act of Love. So using your reactions, how many people on this call are familiar with NIHB's Act of Love campaign? You can use your reactions or raise your hand. Okay. Okay, just a couple of people. Okay, I see some thumbs down. Okay, so that's why we're here today. Awareness. So the National Indian Health Board, in an effort to support tribal communities, in an effort to address vaccine hesitancy, we created a campaign known as the Act of Love. And basically, as Desiree stated earlier, it's a lot about taking those prevention practices, encouraging people to make sure you wash your hands for at least 20 seconds. It is making sure that you keep your distance when you may be feeling ill. If you have like that cough, everyone has those allergies sometimes, but when you're around those who may not have an immune system that can easily fight infection away, it's about masking up. When you go to certain places and it's a large crowd, especially with Thanksgiving and Christmas coming up, when you on the airplane and you using that recycled air and people start coughing and you start making that face looking over your shoulder like you don't know, we are encouraging you to don't take the risk, just mask up. So the National Indian Health Board, we have these kits, and I am not near the box, but our kits come with hand sanitizers, messaging that you can put on magnets. They're magnets that you can either put on mirrors. So if you in a school setting, you might want to put like the hand hygiene magnet that reminds people to wash your hands. or use hand sanitizer. We have them for you to put them on the fridge. There are reminders about when to get your vaccine, your primary doses for the COVID-19 vaccines, and when you can now get the booster, because we know now that the updated Pfizer vaccine is available for people 5 years old and older, and the Moderna vaccine is available for people 6 years old and older. So we have messaging that's encouraging people to get vaccinated. We have hand sanitizers. Oh, I think I said that. But we have the pocket hand sanitizer, because, you know, we don't want you to go through airport security and, you know, we give you a nice kit and then they try to steal it, because we know how that TSA work. But, you know, we have the pocket size, and we do watch the date on the hand sanitizer. So we strongly encourage you to look at those, because hand sanitizers do expire. But most importantly, they're free, right? So NIHB does this as a service to tribes, because we serve you. We serve tribes, we serve tribal organizations. So I included Darby's information in the chat. If you would like to order a bulk supply, that is more than one, more than 20, up to 100 COVID kits, NIHB has the capacity to support every tribal health clinic, hospital with at least 100 COVID kits. If you would like funding, please reach out to me, because there are various funding opportunities that NIHB have to help you purchase COVID kits, especially when I just said there's 2 new COVID variants that are kicking up that account for 11.4% of new cases in the US. We don't want to be at risk again. We want to make sure that we stay prepared, so we have these kits. There are also additional resources from other federal agencies that you may use to tap into to buy those kits. I know someone asked the question about, can you use other grant funding, such as the ARPA, to purchase care kits? I would recommend you talk to your grant advisor, but more than likely the answer is yes, because it is a COVID-19 mitigation evidence-based practice. The CDC does encourage the use of buying these type of kits for individual household use, because you can make them into your own. I don't know your community like you know your community. You might need to include Clorox wipes. For those that have food programs during COVID, this would be an opportunity to include that COVID care kit with the food that you deliver to the households. If you have dialysis centers, this is the opportunity when people come in for dialysis to send them back home with a care kit, so that when they're at home, they have this kit to use to keep themselves safe. So that's it, because we only got 10 minutes and I like talking, I don't want to talk too much. But the bottom line is, NIHB have COVID-19 active love kits that we would love to supply to your organizations, to your tribes. So please reach out to Darby. And I see a hand up. So Jim, is your hand up for a question? Is your hand up for my question earlier? Lorna, Jim? Or maybe she don't realize her hand is up. Okay, do we have any questions about the information I just shared? And so let me address so there's a comment in the chat box about the in-person, the national meeting was only in person and had no virtual options. Are you referring to Charity? Are you referring to the National Tribal Health Conference or Institute? The National Tribal Health Conference. So for that one, the reason that we offered that in person is because when we had it virtual, in the evaluation, we received a lot of feedback that they would like to have it in person because of like the technical difficulties and people miss being around one another. Now, if you would like to have like participate in in-person institute around environmental health, I can tell you right now, we are planning a couple of regional environmental health summits that would be in person. With those environmental health summits, you will receive our new environmental health toolkit. That toolkit will contain a care kit. That care kit will contain like water, like how to test your water, COVID kits, hand sanitizers, masks, like the surgical mask, N95 mask, and cloth mask. We will, can you please put your email individual info that you mentioned to request the kit? Yes, I will put Darby's email back up for the COVID kits. Eliza, can you put that in the chat box for me? And so I will include information about the Environmental Health Summit. And then we're also having an infectious disease institute the last week of February 28th to March the 2nd in Washington. It is in person. We are trying to make sure that it's hybrid like we did last year. I think I learned the kinks now. So we're going to have the option for you to come in person. We will offer scholarships for that. We will have table talks. We will provide CEs, and we will be discussing COVID, as well as highlighting tribes and their success stories. So if you are interested in attending that, please let me know. And if you're interested in being like Desiree and you want to share the awesomeness that your organization and just want to, you know, I want to spotlight you. If you're willing to allow me to spotlight you, please let me know because we would love to have you. So I'm going to turn it back to Desiree because this is her time, and I am going to hush up and put the evaluation in the chat box. Thank you.
Yeah, I think that's great, Dre, that NIHB has those kits available for a broader audience. So good job on that. I know it's really hard with getting back into these conferences and stuff. So we're currently planning a couple hybrid ones right now. Doing the in-person one where we also have to think about these hand sanitizers and things like that for the in-person event, but having that virtual option, I think, is something that's probably going to be here to stay for a while. So a lot of the hybrid options happening right now, which I think is great for those that can't make it in person or, you know, are taking the precaution to not gather in large groups yet. All right. Are there any last questions for me or Dre before we wrap up?
Well, in the art of Miss Dree and her webinars, I would like to take this time to thank you all for being here. And y'all know the routine. Please use those reactions to show some love and support for Desiree for joining us today, sharing her time, sharing her resources, and just being a wealth of knowledge to us. So that's use those reactions because we're not in person to like do a standing ovation. And so those resources that Desiree mentioned, the food sanitation, the assessments, NIHB, I am working to have those placed on the website so that you will be able to download those. USET and Desiree ANTHC work with us to create these templates. They are for you. So all of them are adaptable for you to put them in like your native language, for you to include your tribal logo, your tribal business logo. We made these resources for you. So use them however you see fit. I am here. If there's something else, you let me know. We're also working on a Jeopardy game. We have started piloting a food safety Jeopardy game based off like food security and COVID-19. If your tribal organization is interested in having NIHB come to, or if you would be willing to pilot the game for us and then provide us with feedback, please let me know. Like, we called it food safety and it's fun. And we are having that open for you all. We want to support you. And Desiree is here. Desiree is smarter than me. And she knows that her tribal communities, and she's always willing to be a support. So if there's anything that was discussed on this call, again, how to access those resources, those free resources, because everyone may not have those grants readily available that they can tap into to use the funds to purchase the kits, but there are free money out there. There are free kits out there. I will help you get to them if you tell me you need help. That's why I'm here. All right. So Desiree, you can close us out with no further questions. I don't see any hands raised. We are good.
Thank you so much, everybody. And I know Dre will be sending out the recording and documents, and I did go ahead and put my email into the chat box as well. I hope you all have a wonderful rest of your week.
Drink some water, get some steps in, smile, tell your neighbor hello. Thank you all for joining. Bye-bye.